This is a presentation of a live MACI Arthro for a trochlea defect. This is using the new rods and cones video system. So you can see both the intraoperative as well as the outside of the knee view. So you can see first here we're going to clean up the fat pad and any scarring. This allows for visualization and allows us to do this through the arthroscopic approach. You can see from both portals we're debriding the defect, and then we're going to make the incision and flexion. Again, this is about a 2 centimeter incision. We're going to insert the MACI Arthro cannula. This is a 15 millimeter cannula. You want to make sure you go beyond the black tip of the cannula, and then we're going to use this is the smallest cutter option. We're going to mount this down gently, and then once we get the outline, we're going to slowly use the curettes to prepare the defect. You can see that even surrounding the defect, the cartilage was overall slightly poor, and we're going to clean this up to a harder edge. Following this, we're going to place the cutter in again. Again, deployment is important. You have to elevate the cannula sometimes. Following this, we're going to further cut any edges. Again, care is taken here not to make this defect too large, because the MACI implant will have too much gap on either side. You want less than 1 to 2 millimeters. Following this, we're going to use the curette. We're almost completed, and then we're going to use a small hand curette to fine-tune this so that there is no elevated edges on the MACI when implanting it. Following this, we're going to use a Fraser tip and irrigation. The tourniquet is now down. You can see there's bleeding at one part of the defect. We're going to start off with epinephrine pads. These are similar to spine surgery. And then what we're going to do is focus on gel thrombin. So the gel thrombin is going to go in there. If there's still bleeding, you're going to see here we're going to do to seal, and then similar to what we do in an open procedure, we're going to use the fingertip of these gauze, and you can see we're pressing into the to seal into the defect to try to reduce the bleeding. This essentially is going to clog these capillaries with this to seal. Following this, we're going to use the V shuttle to get our trajectory, essentially a dry run, and then we're going to turn our attention to prepping the MACI. Again, cell side is up. We're going to mallet on both sides, and then we'll pull this away and we'll put this in the medium, and then we're going to slide this onto the V shuttle. You can see here you want to make sure that the MACI is on both sides of the fingers so that it can be deployed appropriately. Again, this has a great suction seal. It will not come off until you fire the V shuttle. Now what we're going to do is place a little bit to seal on the defect, and then we're going to use the V shuttle to put the cell side down, and you'll have the shiny side up. Again, key here is to deploy it as close to the orientation as you want, or possibly can, and then you're going to use the small plastic tape to gently maneuver the membrane into the defect appropriately. You can see here we have an excellent fill, and what we're going to do now, as you can see, that we're going to do one more slight adjustment to remove any air bubbles, and after that we can start doing the final to seal glue. So you'll wait 3 minutes, and then we'll place another round of to seal and wait 3 more minutes. After this is complete, you can see here we start from the top. Again, gravity will bring the to seal down, and you want to coat this well enough that there's no fluid leakage. If you need to do any adjustments, again, that plastic tip works quite well, and you can see here we're taking out any more air bubbles from this area and making sure that it's appropriately coated on all sides. Following this, we'll arrange the knee. You can see here this is similar to an open environment. There is no pulling off of the defect, and the MACI has stayed on without any issues. And again, we're taking through the 0 to 90 range of motion. Thank you.